Dr. Majid Abdi is kicking his legs for the keynote lecture. Dr. Naeem Laghari is also eagerly waiting. Dr. Nadeem Bajwa is also eagerly waiting for the keynote lecture. And I will proceed to the Dr. Vajdev is also here. Dr. Vajdev, I was also mentioning your very good work for the website. You were here. So moving to the first keynote thematic lecture of the night, and he graduated from Khyber Medical College. He moved to United Kingdom for his fellowship in psychiatry. He came back to Pakistan, established a psychiatric department in Lady Reading Hospital, Peshawar. Later on, he moved to Khyber Teaching Hospital and also chaired the unit of psychiatry department. He became the principal of Khyber Medical College in 2004. He also had the role of President Pakistan Psychiatric Society. He chaired South Asian Division of Royal College of Psychiatry, United Kingdom. He was formal zonal chief of World Psychiatric Association. Currently, he is chief executive Horizon Ibadat Hospital. He has authored many books and also many research articles. He will be talking about the mental health of mental health healers. Ladies and gentlemen, please welcome Professor Khalid Mufti.
Bismillahirrahmanirrahim. Nahmaduhu wa nusalli ala rasulihil kareem. Amma ba'd. It was a great honor for me to be here tonight, invited by the Pakistan Psychiatric Society. So, thank you very much, the President, Pakistan Psychiatric Society, the Cabinet, all the 5 chairs from Pakistan, and my splendid colleagues who are sitting here and even, who have contributed a lot. Ladies and gentlemen, the first thing which came from the hall, some people sitting here, is poetry. So I think we'll come to that after a serious note of discussing today's important topic, healing the healers. Ladies and gentlemen, I begin my talk from the message which I have chosen from the book The New Directions Transforming Our Lives. John Nesbitt is a motivational speaker in the United States and was very popular in 1980s. He said that in turbulent times, in times of great change, people head for the two extremes, fundamentalism and personal spiritual experience, where there is no membership or even a coherent philosophy or dogma. It is difficult to define or measure the unorganized New Age movement but in every major city, thousands who seek insight and personal growth cluster around a metaphysical bookstore, a spiritual teacher, or an education center. And I remember in 1997, the best-selling book in United States was selected poems from Maulana Rumi. And my personal request will be that I'll really relearn and appreciate if there is a little silence. It will not be more. I'll try to finish it in time. I thought to choose a topic which is serious, which is challenging, which is really a catastrophe, and where the physicians are involved, healthcare workers are involved, including the psychiatrist, and that is, COVID-19. The spread of this COVID-19 across the globe is colossal. One such unrecognized area, although there are some other unrecognized areas, but one such is mental health issues which are developed in the medical staff during the pandemic, and the President Psychiatric Society also touched on this point for a while. During COVID-19 pandemic, female frontline healthcare workers, they have faced immense psychosocial pressures ranging from unsupportive family norms, unwelcoming working environment, insensitive hospital administrators, and rumors spreading all over about the COVID-19, as well as some of the missing incentives, no incentive for the hard work which doctors do, particularly the ladies. This is a Pakistani paper by Shahbaz and Ashraf in BMC Women's Health, quoted in a large number of publications. At least 1 in 5 healthcare professions, they report symptoms of depression and anxiety. Almost 4 in 10 healthcare workers experience sleeping difficulties and insomnia. The rate of anxiety and depression were higher for female healthcare workers and nursing staff. Mild mood symptoms are common, while mild and subthreshold symptoms like health anxieties are also not monitored properly. Now, health anxiety, which I refer here, and I was myself a little bit muddled initially, but I found out the definition by the same authors that health anxiety is an obsessive and irrational worry about having a serious medical condition. It is also called illness anxiety. Recently, also, this subject is touched upon by WHO. Now, the pandemic is likely to put our healthcare workers across the world in an unprecedented situation, making impossible decisions, that is, work under extreme pressures. We all know how to allocate few resources to needy patients, and how to balance their own physical and mental health needs with those of patients, very important, and how to align their desire and duty to patients with those to family and friends, how to provide care for all severely unwell patients with constraints or inadequate resources. The same thing applies in Pakistan these days. And this may cause some to experience moral injury or mental health problems, which I'll let you know. Moral injury is a term that originated in the military in Second World War and can be defined as the psychological distress that results from actions which violate someone's moral or ethical code. It's unlike formal mental health conditions such as depression, PTSD, moral injury is not a mental illness, but those who develop moral injuries may ultimately experience they experience more negative thoughts about themselves and about others. For example, I'm a terrible person. My boss he doesn't care about patients' lives. Particularly the medical students, they fall in this kind of category. We have also noticed in our time that we might have been suffering from this moral injury. Now, in contrast, there is a resilience. And people who accept and are contented with significant challenges, moral or traumatic, a degree of PT, post-traumatic growth, a term used to describe strengthening of psychological resilience, esteem, outlook, and value after exposure to highly challenging situations. What are the signs of post-traumatic growth? We know, we have been listening that in COVID, some people have grown as well. Appreciation of life, relationship with others, new possibilities in life, personal strength, and spiritual change. Whether someone develops a psychological injury or experiences psychological growth is likely to be influenced by the way that they are supported before, during, and after a challenging incident. Now, the medics and the mental illness is quite common amongst doctors. Suicide rates are higher than for most other professional group. Today is the International Suicide Day. Personal, professional, and institutional stigma exacerbate mental health problems amongst doctors. Patient complaints are a significant factor leading to mental illness and suicide among doctors, particularly in the West, when they go for various kind of remunerations and legal issues. Prevalence of substance abuse disorder is similar to that of general population, and some groups such as anesthetists are probably more vulnerable. Now, suicide in healthcare workers, I thought it's an important thing, and by the day is also designated to come to just think deeply for action as the suicide health day. For suicide day, there was a message that suicide may be ameliorated through action, not only by slogans. And probably the President, PPS, also pointed towards that. There is a large data regarding the impact of COVID-19 on physicians' mental health and suicides. There should be large data, but there is very little is available throughout the world. However, the stories published in the press regarding suicide by health professionals paints a grim picture. We lost our 2 psychiatrists last year through suicide. There are also stories of paramedics, nurses, technicians, and other workers in the medical field who have died by suicide during this incredibly difficult time. These few stories which reach the press are likely only a small fraction of the true loss of life during this time. There are several factors, ladies and gentlemen, that contribute to the higher rates of suicide seen amongst physicians. Number one, physicians have extensive knowledge of pharmacology, including the lethal doses of medications, which make suicides by overdose more frequently lethal than in the general population. Physicians also have increased access to potentially lethal medications within a hospital and their clinical settings, and physicians tend to use suicide methods of higher lethality including firearms and hanging.